Hi, this is a 34-year-old male comes into the clinic with chief complaint of right lower back pain. Description was an achy pain that was ranked as a 4, sometimes 5 out of 6. It was an abrupt onset brought on by doing gardening outside the house. When he first noticed it, it wasn't that bad. Thought it would go away on its own. He tried using hidden pads, ibuprofen. Sometimes takes 2 tablets, 400 milligrams, sometimes 3 or 4 twice a day, and does not. It seems to help a little bit, but not quite. Um, so the pain is throughout. He noticed that it was worse in the morning.
Throughout where?
Throughout the day. So the pain is
okay.
throughout the day,
Okay.
but it's worse in the morning on the right lower back. But he describes also the left side that also hurts. His past medical history includes back injury 20 years ago, had surgery, did take Motrin back in the day, and it seemed to help. Other than that, no other problems. Only medication that he takes is ibuprofen for pain, and sometimes he uses a heating pad. Okay, for social, um, lives alone, drinks alcohol, one glass of wine, 4 ounce glass with a meal, does not smoke, does not use um, recreational drugs. Um, for work,
Is he in use IV drugs, or is he over?
no IV drug use. No IV drug
Did you
use.
ask that question?
No, I did not ask.
Okay. So then the answer is you don't know.
I don't know.
Okay.
Yeah. For work, computer. So sitting behind the desk with using the computer. Let me see. No troubles. No exercise. For exercise, used to go to the gym. Has now stopped going to the gym. I believe related to the injury, current injury.
So you're 2 minutes and 40 seconds.
Oh, thank you for reminding me. Uh, uh, he did used to walk, but no longer doing that. So that's it.
And before you go on, is there any review of systems that's
The
relevant?
yes, the review of system. Um, every general is no fever, no chills, no loss of weight, no malaise, no nausea, no vomiting. And medications we've gone over that. No allergies, and surgery a long time ago from a previous sports related injury. For relatives, for family history, has got does not know what the parents died of, um, and nothing significant. No injuries, no cancer in the family that he knows about. Um, that's it.
Let's move on to physical exam then.
Okay, physical.
4 minutes.
Okay, physical exam, general, aleatory times 3. All systems are negative except for the musculoskeletal pain on the right side, lower back, rated as a 5 out of 6 with limited range of motion, with right leg, right hip flexion.
So limited range of motion of what?
Of right leg.
Of the right leg.
Of the right leg hip pain, limited. And then
so limited range of motion of the right hip.
Of the right hip.
Right hip.
Right hip.
Okay.
When he got up, limited range of motion on right lateral turning, right lateral spine rotation.
Okay.
Limited range.
Rotation.
Yeah, rotation. Okay. And the pain was 4 out of 5 with that. Ambulation, no difficulty. Negative for shuffling, imbalance, no scoliosis. Um, um,
Did you actually do a scoliosis test?
um, no, no, she bent, but I meant to check the
Okay.
check. All right. Uh, deep knee flexion. I mean, everything was not significant or anything, including
Okay.
deep tendon reflexes.
Okay.
It was a 2 out of 2 on the knees.
Okay.
Um, muscles was 5 out of 5 on all of them.
Okay. And so everything was 5 out
5
of 5.
out of 5 for muscle strength.
Okay. So there's no weakness.
No
anywhere.
weakness anywhere. Negative. Respiratory, no aroused, no auscultaceous sounds. And I believe that's everything.
Okay.
How much time
So
is
what do
there?
you think? So we're at 6 minutes. So what do you think's going on, and what do you want to do?
Okay, so um, primary diagnosis: sciatica, muscle spasms,
Sciatica. What level do you think?
S L4,
Okay.
L4,
Alrighty.
muscle spasms, spinal fracture. This is just a possibility.
Are you're going through differentials now?
Differentials,
Okay.
yes.
So muscle spasms, spinal fracture. Is there any injury that would make you think of a spinal fracture?
He was digging, and I'm not sure whether he did something that would possibly cause any fractures that he doesn't know about.
Okay.
He's 34, and they're usually robust people, and so they.
And any falls or anything, or any car accidents that would make you think of a spinal fracture?
No.
Okay, that's okay.
Okay.
I just want to know
Okay.
why you're thinking that.
And herniated disc,
Okay.
and cannot afford to miss cancer or bone cancer.
Bone cancer.
Yeah.
Okay. And what makes you think that might be on the list?
Because of his age and thinking about maybe his lifestyle.
Lifestyle with what specifically?
Well, maybe I can't remember. Did you say he got cancer in your family history? No.
Okay. But lifestyle. I mean, smoking, drinking, drugs.
Yeah.
What's in the lifestyle that makes you concerned about cancer?
Sometimes with smoking, that can cause cancer. But
Okay.
in this case, I think he said he doesn't smoke.
Okay.
But
Okay. So
cannot afford to miss. We cannot actually rule out maybe cancer, but it could have been cancer.
okay, he could get an osteosarcoma, so that's it's usually younger.
Yeah.
But yeah. Okay.
But I don't think I checked the abdomen to see the aorta to see. Yeah. Okay.
All right. So what do you want to do for him going out the door today?
So a little bit of teaching, and I want to do try a few things. Seems like the pain is getting worse. I mean, better on its own already.
Okay.
So maybe continue using heating pads to alleviate the muscle aches.
Mm-hmm.
I would like to try and use Tylenol for pain.
Okay.
I would like to try and use to teach him about if the pain does not get better within 10 days to come back.
Okay.
And maybe we can actually even give him some numbers for some local PTs that can probably help him with.
Okay, so you'd like to send him, refer him to PT then?
Refer
okay.
to PT.
Would you give him any medicines?
Not right away, not today.
Okay.
Because the pain doesn't seem to be where it needs that heavy drug.
Okay. Any treatments in clinic?
No.
Okay. Ready? And when do you want to follow up with him?
In 10 days.
Okay.
In 10 days.
Okay. And you tell them what are alarm symptoms?
So the alarm systems are alarm signs are if the pain gets worse than it is, to go to ER. If we are closed, because this is a clinic. If the pain gets worse or some redness or erythema, to go to ER as well.
Okay.
Any area that is opening up on the skin to come in as well. Broken skin.
Okay. Alrighty. Okay.
So a lot of teaching, mostly teaching.
Okay. What's something that we talked about in the lecture that would be an alarm thing that you would send them to the ED?
So, for instance, if they're walking and they have pain.
So he's going to have pain. The pain's probably going to get worse. I want to send him to the ER if the pain gets worse. But what really is an emergency that we talked about?
Oh yeah, we did talk about.
So in the breast cancer case example,
yes.
What were some of the symptoms that she had?
Metastasized cancer.
So spinal cord compression is what I'm looking at, and what would be the symptoms of that?
Increased.
Sorry, I didn't ask the question right. Spinal cord compression from the metastasis. So specific things that you would tell her to go, or him to go to the emergency room.
Yes, for sure. If he wakes up and the pain is restricting him to do anything, then that's a reason to go to ER. Did I answer your question?
No.
I'm sure. I feel like I'm missing something.
Yeah. So what I'm thinking of is the saddle anesthesia. So numbness.
Numbness and tingling.
Okay, and then increased weakness and so pain. I wouldn't tell somebody to go to the ER for pain necessarily, but increased weakness. Yeah, and then the saddle anesthesia. Okay. Yeah. All right. So let's stop there. So that actually was 12 minutes.
All right.
So we want to try and do all of that in 3 minutes if we can. Okay. Now the questions that I'm asking, those are actually the kind of questions that I would ask as a preceptor. So part of what you have to build in for clinical work is that you're trying to package this in 3 minutes, plus answer the questions within that 3 minutes. So we still need to scratch, squish it down. And so what I tell everybody, every year I tell everybody this, is I recommend that you practice doing this, both of you, in front of the mirror, tape it, but practice it 3 or 4 times, like in the next day or 2 while it's still fresh in your mind. Try and get it down to 3 minutes.
Yeah.
Okay. So what you're doing is it's like you're boiling it down to just the essence of what has to be shared.
Right.
Okay.
Okay. I think I stopped.